Now let's talk about long COVID. It's on the increase, of course, as the number of coronavirus cases increases, so do the number of cases of long COVID. And it's been dominating the news headlines.
According to research by campaigners, there are more than 80,000 children in England living with long COVID.
They call it the silent illness. That's the adults, but it's affecting our children too.
As rates stay high, we are going to have to worry about long COVID more than we have been in the last few months. Young people, median age around 20, have a 1.2% chance of having our definition of long COVID.
I would say that the risk of severe consequences from long COVID are very significant for young people. The likelihood of you getting long COVID is more or less the same in all age groups and can be debilitating. It can impact your mental health. It can make it very difficult to do any physical activity for months.
What we realised from a very early stage that as patients were well enough to go home, they clearly weren't recovering as quickly as we would have hoped and expected. And so we realised there was something important to discover here, and we realised follow-up of these patients was going to be important.
There you go, some recent headlines concerning long COVID and then also long COVID in children as well, which we'll be picking up with a little later on. A recent study shown that more than 2 million adults in England may have suffered from longer lasting symptoms after they contracted COVID-19. This, of course, is long COVID. The REACT study that we're talking about highlighted about a third of people who'd reported they'd had coronavirus symptoms or one or more symptoms had persisted for at least 12 weeks. There's been an increase in the number of children who are suffering from long COVID too. But first, let's focus on adults, what we know so far, latest research and development as well. We'll look at the REACT study with Danny Altman, who's a professor of immunology at Imperial College London. We'll also get on the line as well Elaine Maxwell, who's a scientific advisor at the National Institute for Health Research and on the NHS Task Force for Long COVID. And we'll speak to Jez Medinger, who's a science journalist who's got lots of case studies. We'll be speaking to him a little bit later on. But for now, Professor Danny Altman, good evening to you.
Hello.
And Elaine Maxwell, good evening to you.
Good evening.
Danny Altman, let's pick up first of all on the latest REACT study. So where are we with figures and understanding of the scale of long COVID at the moment?
I think it's becoming clearer, isn't it? It's still very hard. So REACT obviously is very useful because, this is really large-scale stuff where with no prior assumptions, this is simply sending out questionnaires to people and asking how long did you have these symptoms for. So these aren't people who are coming forward or joining groups or there's no bias in this at all. It's simply an assessment of how long did your symptoms last, and it puts long COVID somewhere at the kind of upper limits of where we thought it was. So. We've been bickering over should we call it 10% or 20% or more than that, and in a way it's a sort of futile bickering, isn't it? And because people just want access to care, but this puts it certainly nearer the upper limits than the lower limits, and certainly counting more accurately helps just in terms of working out how much provision we need.
And that's one thing that we are arguably missing, isn't it? Perhaps a more long-term plan for sufferers of long COVID. I know that there's been a lot to deal with in the instant, but I'm of the opinion that this could be the next public health crisis for us if something isn't done, quickly about the scale of these numbers. There are clinics that have been set up, but is it safe to say that we're still on the back foot in terms of our understanding and our provision for long COVID sufferers?
I think that's a very good way of describing it. I don't think we're, dealing with it adequately at all yet. After all, we've been through something so ghastly in the last 18 months. It's made us very hardened, hasn't it? It's made us say, well, if people weren't actually going to intensive care and dying, then maybe everything's okay. But, there's a great deal more to life than not dying. And, if particularly this evening we're going to be talking about long COVID, especially in young people, we're talking about, wrecked lives, wrecked hopes, wrecked educations. There's a lot of other stuff to care about, and I often in this one of the ways that I came into this was doing a lot of work that we do in Brazil, where we have a similar kind of preoccupation with a viral infection called Chikungunya. It's a mosquito-borne viral infection. And if you look at the situation in Brazil, what really strikes you is not just the infection itself, but the way that the long-term consequences really pull society apart in terms of lost livelihoods and lost jobs and pressure on the healthcare system. And, I worry that that's what we need to face and we haven't really grappled with yet.
OK, let's bring in Elaine Maxwell, Scientific Advisor at the National Institute for Health Research and on the NHS Task Force. Good evening to you, Elaine. Thanks for joining us.
Thank you.
So talk us through how the NHS is starting to grapple with this. And I'd also be keen to know what we understand as well. There are developments, research going on all the time. And every time we specialise here on the show in long COVID, we always learn some new and interesting facts that have emerged. So let's just concentrate on that actually first before we talk about the NHS side of it. So what have we developed in our understanding of long COVID? There's been some research about women, for example, hasn't there?
Yeah, so one of the things that's very clear is there are a large number of people who have continuing symptoms after a COVID infection. And interestingly, we're learning a lot of people who are asymptomatic have these problems, have long COVID. So there's a big study in the USA, looked at 2 million people, and they report that 19% of people who were COVID positive but asymptomatic developed a post-COVID condition. So the first thing we've learned is it's got nothing to do with how ill you were with your initial COVID infection. Second thing we've learned is that people have different sets of symptoms, so different patterns of symptoms. And some of the difference in the percentages we see of people who've got long COVID depends on how it's measured. So what symptoms do you include in your list? So the REACT study asked people to say what symptoms they had, whereas the ONS study has got a list of symptoms. And one of the things that we're learning is that there's a lot of problems that women have, particularly menstrual cycle disruption, which affects young girls who start their periods earlier, affects women who are menstruating who have longer periods, and affects some people who are postmenopausal who've started bleeding again. But these symptoms don't get on to everybody's lists.
Right, so it isn't necessarily picked up.
Yeah, it depends what you're looking for as to what you find, and depends what's on your list of symptoms as to how many people you think have got long COVID. But the other thing we've learned is that people have very different levels of disability. And I'm much more concerned about the number of people who have had long COVID for 12 months or more, and it's growing. So in March, ONS estimated it was 70,000 people. In May, that had shot up to 376,000,
wow,
which we expected because between March and May last year, we saw the number of infections go up. We saw infections go down last summer, so I think it'll continue to slowly increase over the summer. But when we see the people who are in wave 2 and wave 3 who got long COVID mature into a year, I think we could easily have 1 million people by Christmas who've had long COVID for over a year. And that is tipping over into a long-term condition.
Okay.
And that's a real problem.
So the NHS has got to find some more resource for this. We know that there's been some clinics set up. There was some emergency sort of funding there, certainly last year for long COVID clinics, and many, official clinics have been set up now. How's that going, Elaine? What is demand like? Are we hearing enough about these clinics?
So, in total, 89 clinics were set up. So in the end, in the last financial year, £24 million was putting into setting up these clinics. They operate very differently. So the clinic in London will be very different from the clinic in Exeter, for example. What we do know is all the clinics have got waiting lists. And so a new plan came out from the NHS on the 15th of June. And so there's going to be an extra £70 million put into those clinics. But the modelling for the clinics, is an assumption that there will be 68,000 people who will need to be seen in these clinics. Now, if you set that alongside the fact that there's already 385,000 people who've been ill for over a year, it's quite clear that not everybody is going to get to a clinic.
Okay.
There's also £30 million being put in to support primary care and give more education for GPs. And there's going to be 15 paediatric hubs. But that is only going to be the tip of the iceberg. We really have to think as a country how we're going to support the rest of these people.
Yeah. What's your role? What's your association, Elaine, with the NHS task force?
So I'm there as an advisor. I work for the National Institute of Health Research, and we published a review of the evidence on long COVID in October. We did an update in March. And so my role is to sit on the task force and advise what we're seeing from the research and what's coming down the line.
Okay, and in your capacity as an advisor, you can only present the facts as you find them.
Yeah.
Are they being received and acted upon proactively enough? Is there any frustration there that the NHS would like to be doing more, but the funding isn't there? Or perhaps the NHS feel that they're doing enough at the moment? Is there any barrier here that's stopping us from, really trying to excel in getting to the bottom of long COVID and making sure that people suffering are receiving continual treatment?
So I think there is a will to do something. I think, as Danny's pointed out, our understanding of long COVID is still limited. We, in our reviews, said we think it's an umbrella term for a number of different conditions. So there's not going to be just one cure for everybody. No. But I actually think the biggest problem is not going to be the money, it's the workforce. The NHS is struggling at the moment. It's, getting really high rates of emergency presentations at A&E at the moment, and it's July, not winter. We know that there was a high rate of COVID infections in healthcare staff. We also know from the ONS figures that you are most likely to get long COVID if you're a middle-aged woman working in healthcare.
Right.
To then try and set up a massive new service on top of the pressures the NHS already has and the backlog of waiting list means that we're going to struggle to have the people, even if we have the money.
Okay, Danny Altman, let's bring you back into this. I'm keen to do a bit of a dive into anything else that we are able to ascertain from the last few months' research coming out. Of course, we're learning things all the time. Anything from your perspective, Danny, that you think is particularly progressive or areas that are, should be expanded upon when it comes to our understanding of long COVID?
Well, I suppose the picture I'd paint is that, we all have a hunch about what we think long COVID might be in terms of, all those things we've spoken about before, from, dysregulated immune subsets and autoimmunity and reservoirs of uncleared body like the gut. So all these ideas are around, probably many others as well. And I'd say we're probably in a phase at the moment where we're gradually moving from that initial counting of cases and, is this a problem? How big a problem is it? Who has it and where are they? To the first, the beginnings of some of the mechanistic studies that we really so desperately need to actually have some mechanism which would offer diagnostic tests, which would offer some really serious clues for which kind of diagnostics are going to work. But fairly early days at the moment for that stuff.
Okay, interesting. All right. This is Kait Borsay on Times Radio. We are discussing long COVID at the moment, joined by Professor of Immunology at Imperial College London, Danny Altman, and also Elaine Maxwell as well, Scientific Advisor. She works for the National Institute for Health Research, and she's on the NHS Task Force as well for long COVID. I'm not sure who to wing this one to. I'm going to send it to you, Danny, if that's okay, because I've had a text in here to run by you, or a tweet from Luna Maud, who says, my husband has vaccine-induced long COVID, no coverage of this. Is that a thing? I mean, that's obviously, they are pretty certain about it, but have you heard instances of this before?
I'd be interested to hear what Elaine thinks as well. So I've certainly heard rumours of it. I've got no, I've not seen it, and I've got no specific insights into it. I think, it seems to be a thing, so I've heard rumours of it, but I'd be interested to hear what Elaine thinks.
Yeah, Elaine, anything from you on this?
So, again, I think I've heard these stories. I haven't seen any studies into it, but I think one of the things that is very clear is that long COVID isn't just a prolonged recovery from an initial infection. And it does work in different ways. As I said earlier, people who had no symptoms of their initial infection are getting long COVID. So we really don't understand the mechanism of how it's happening. So there's two issues really. We don't know whether a vaccine will protect you from long COVID. And I suppose the corollary of that is we don't know if it might actually cause long COVID. We just don't know.
Okay, so we haven't got any definite information on whether vaccines cause long COVID effectively. No. Okay.
No research studies on it that I'm aware of.
Okay, all right. Keep the questions coming in. Times spatial message to 87222, and you can also tweet us at Times Radio as well. I do want to bring in children now, and we'll start our discussion on this and run it through after the news as well. As we've been hearing, the number of children who are suffering from long COVID is on the increase. This comes as the government in England at the moment has no plans to vaccinate all children. Should they be vaccinated? That's a question we can ask, and we should throw out to you at home as well. A little earlier, I spoke to Dr. Binita Kane, whose daughter has long COVID, and I began by asking her.
So my daughter's 10 years old, and prior to her being ill in January, she was just a normal 10-year-old, swimming, doing gymnastics, karate, cycling. She was very active and had a very full life.
Okay, and tell us what happened in January. She contracted COVID.
Yeah, so she had a viral illness. No, she didn't test positive for COVID at the time, but it was the same week that two people in my office had come down with it. I'd just done a week on the respiratory wards, and she hadn't been anywhere else for at least 3 weeks before that. So and she had all the typical symptoms, including the altered taste. I don't know if you've ever tried swabbing a sick child, but it's not very easy. But by all intents and purposes, it was quite a mild illness originally. She was a bit unwell for about 4 or 5 days, but it kind of just left her quite fatigued. And then a couple of weeks later, she ended up being rushed into hospital with severe abdominal pain. She had a kind of a full workup, and they diagnosed kind of enlarged lymph glands in her stomach, probably due to the virus. And then it just kind of carried on from there, really, and she's just never recovered.
Crikey, so that must have been really alarming as a mum for your daughter to contract COVID, but to sort of suffer fairly mildly, for then this to sort of blow up really a few weeks later. Tell me what was going on in your head as she was admitted to a hospital.
Well, I genuinely thought she had appendicitis. She was quite alarmingly in pain, and I've since discovered that this isn't an uncommon feature of kids who are suffering with long COVID. A lot of them do suffer with abdominal pain, and actually she was recovering. So by about the March, I would say she was back to about 50%, could manage a short walk. But the real turning point was school. When schools reopened, she wasn't 100%, but we were kind of in that mindset, well, she needs to do enough, or she'll get deconditioned and her muscles will waste away, versus, we don't want her to do too much. So kept her off PE, but, almost left it to her to decide. And after, and she just kept relapsing. So school was just too much for her, but it took a little while for the penny to drop. And because we didn't have a proper diagnosis, I didn't, have the right advice. I'm not a children's doctor. It wasn't until we took her out of school that she has now started slowly recovering. And that was a massive decision.
Was it you that sort of had to diagnose her with long COVID, or did the doctor arrive at that conclusion?
So look, I'm incredibly lucky because I'm in the medical profession. I was able to get a professional opinion. I mean, I still had to wait quite a long time for the paediatrics clinic, but that was fine. And eventually when she was seen, she had all the tests done. Quite characteristically, the tests come back normal, and this is what's happening to lots and lots of children up and down the country, that the tests don't pick up whatever the damage is being done at cellular level. The tests are just not the right tests. When they come back normal, many people are getting fobbed off and said, being told that their children have anxiety, or it's in their head, or there's hundreds of parents and kids up and down the country who are really quite desperate because they're not being listened to, and they're having quite a poor experience of care.
So you're doing most of the caring. Do you feel like your GP is on your side? Do you feel like there's enough interest there to be trying to get some answers, although your daughter's slowly getting better? Or is this sort of having to be pushed forward by you? Do you feel like the only one really pushing for answers?
So, look, I see it from both sides. I am a respiratory doctor. I have sat on some of the committees and things that are trying to set up these long COVID services. They are woefully underfunded at the moment, and most of what's going on, people are trying to do it on top of their already busy jobs and the huge backlogs that we have in the NHS. It's a condition doctors don't understand. There's been very poor teaching about this sort of condition in medical school. We are not taught about it, and it's not surprising, therefore, doctors are stumped by what's going on. The services aren't there, the support isn't there, and therefore parents and their kids are almost being left to fend for themselves in many ways. And the Long COVID Kids Support Group has just been a hugely influential part of all of this, set up by the wonderful Sammie McFarland, who sadly has long COVID herself, as well as her daughter. But they have lobbied government, and they're doing a huge amount of work, but it's coming from the patient
it's all
body,
coming from
if
the
you
patients.
like.
Yeah, we'll be speaking to Sammie in just a few moments' time. Tell me about your daughter now then. So how do you manage her condition? And actually, how is she? Because it must be frustrating for her as a young child not to be doing everything her friends are doing.
Well, when I told her I was doing this interview and I asked her, how she would describe her illness, the words she used were, "It stops me from doing everything I love. And even when I'm well enough, it stops me because I'll pay for it the next day." And that's the really heartbreaking thing about it, that she, the fun has kind of been sucked out of her life. She's been literally stuck in the house, bar one or two outings, tentative outings since January. She can't go to school. She has to, do these kind of enforced rest periods, if you like. She's had to reduce her screen use. It's really challenging for a 10-year-old, but she's coping remarkably well. I just think that's the incredible thing about children. They are so resilient despite what they have to face sometimes. And, I couldn't be prouder of her, really.
Are you sort of treating her in any way, Binita? If any parents are listening to this who think their kids might have long COVID, is there any sort of parent-to-parent advice that you could pass on?
Yeah, I think the thing to remember is that every child is different, and this has a massive variation in symptoms and how sick children are. So Jasmine very much has the type which is sort of classified as ME/CFS, which is chronic fatigue syndrome. But there are lots of kids who are having chest pain and palpitations and blood pressure problems and hives and skin rashes. So there isn't a one-shoe-fits-all piece of advice I can give. We are very much treating, making sure she's eating well, that she's getting vitamin supplements, that she's taking probiotics, and that she's getting plenty of rest, and she's convalescing. What I would advise is you cannot push through these symptoms. Don't try and push through fatigue. And if your child has got some of the more worrying symptoms that I've just mentioned, then ensure that they are seen by a specialist.
That was Dr. Binita Kane, who spoke to me earlier about her daughter Jasmine, who's 10, who's been suffering from long COVID since January. Good evening. We're talking long COVID here on Times Radio this evening. And the focus, certainly for the next 10 minutes or so, will be on children who are suffering from long COVID. Sammie McFarland is the founder of Long COVID Kids, an organisation whose aim is to highlight long COVID symptoms in children. They've organised a petition which aims to create awareness for parents and to change government policy to remove barriers for children accessing a free COVID test. And Sammie joins me now on Times Radio. Good evening, Sammie.
Hi, Kate. Thanks for having me.
A pleasure. So tell me why you formed Long COVID Kids.
So it started off just for a dire need to raise awareness. My daughter and I were struggling to recover from our infections from March 2020. And in May, we were still ill and finding it really difficult to find any information or get any support. We had a particularly uncomfortable situation in our own surgery. And I came away feeling very hurt, very angry, very isolated. And after 3 days of crying in bed and being really upset about it, I decided to have a look online and see if there were other people who were struggling to get well. And from there, the floodgates opened, really. We created an awareness video, put it on YouTube, and suddenly we had 300 families all having a similar experience. And we've continued to grow to now over 3,000 children in our group.
Tell me about the experience in the surgery, because this will be common, I think, to how many people suffering long COVID felt, certainly in the early stages, perhaps even now.
So I went along for a second blood test. The GP had originally come out to the house to give me a blood test thinking I had a secondary infection. I didn't, but they thought that I had something wrong with my kidney, so they gave me a second blood test to check for that. And when I went into the surgery, I went in on my own. My daughter wasn't with me, and I was asked how I was. It was the first time I'd seen another human for months, right at the beginning of the pandemic, and I burst into tears, and she said, "Oh, I think you're depressed." And I reasoned with her and said, "I don't think I'm depressed. I think I'm just really fed up and worried about not getting better." And I said to her, "Well, my daughter's actually got very similar symptoms. They're not the same, but she's also struggling to get better." And she said to me, "Well, children don't get COVID, and she's got anxiety. She'll feel better after lockdown." And I felt really guilty. I felt like it was my fault that she wasn't getting better and that I'd done something to prevent her from getting well. And it was a really isolating moment where there was no other point in my parenting career where I haven't been able to Google something or look it up in a book or speak to somebody about it and find someone who had experienced the same. And it was just awful. And it's not something I want any other parent to have to go through.
When you started scratching the surface, Sammie, and setting up an awareness group, how long did it take before other parents started contacting you and you realised that this definitely wasn't an isolated incident?
It was very quick, actually. I managed to connect with 7 other parents through the adult long COVID support group. We made the awareness video, put it up on YouTube, and that was at the end of October. And within, not even 10 days, I don't think we had about 300 families, and then continued to grow at about 70 to 100 a week. For many months, and still continuing to grow.
Okay, your petition, tell us a little bit about that, about testing.
So there are lots of barriers to children accessing tests, and there always have been, and this is a huge concern because we feel that parents haven't ever been given a really clear guidance on what symptoms to look for in children and how to get a test. And if you go to the government website and look to get a test, the website will ask you if you have the 3 classic symptoms, the cough, the fever, the loss of taste or smell, and that's very rarely what children present with. And that immediately poses a barrier to accessing a test because you basically have to lie if you want to get your child a test. Or what tends to happen is we get, a lot of emails, a lot of messages through our Facebook page asking us if we think their child should have a test. So we'd like to see that list of symptoms updated. We'd like to see those questions changed so that it's really clear that children can be tested if they have any symptom of unwellness, actually, and particularly sort of gastrointestinal issues, nausea, headaches, chest pain, dizziness, generally feeling unwell, even cold light symptoms. Unfortunately, coronavirus does seem to present very differently in children.
Okay, I suppose the government would argue that they do make tests available. Rapid tests are available in boxes. We're all meant to be testing our kids twice a week using those lateral flow rapid tests. What would you say to that? Do you not find them satisfactory? Do they not work properly for you? What's your take on those?
So we've been calling for this change since we started back in, autumn 2020. And some of the issues with the lateral flow tests, obviously, they're not as reliable as the PCR tests, but also they don't fit very well in small children. They're big tests. It's very difficult to hold a small child still and get a swab up their nose if you're a single parent and you're, trying to test them on your own. It's even harder. And often parents tell us that if they've got multiple children that are unwell, they'll pick the most compliant child, perhaps the oldest child, and test that child and then just make an assumption that the rest have got the same because it is such an uncomfortable experience. So this is a problem with testing, and we've been asking, is it possible to even just make the test swab smaller? But unfortunately, that hasn't happened.
Okay. Do you favour children getting the COVID vaccine? There's no plans at the moment for that to happen, but we're talking about, Freedom Day, life reopening a little bit. Where do you stand on vaccination?
I think vaccines should be offered to children. They've been used widely in America and Israel. Millions of children have had them already. It should be parental choice because, that's really important. And if children don't have vaccines, what protection do they have?
Yes, very true. What's your support group called again, and how can we find you, Sammie? I'm sure that there are plenty of people listening to this who would like to look you up.
So we are longcovidkids.org, and we are on Twitter, Facebook and Instagram, so very easy to find. And
there's a whole lot of information. It's a very good website, Sammie. I've been on it several times, and lots and lots of resource there for anyone listening whose children are affected by COVID, or you think they might have long COVID but you're not sure, or indeed anyone you know as well who might find that useful. longcovidkids.org. Sammie McFarland, listen, I wish you well. It is a long journey for you and your daughter, I'm sure. And thank you for speaking to us. I think you're currently camping, are you, Sammie? So I'll let you get back to that.
Thank you very much. I had to come up and find some signal. Thank you.
All right. Take care. Good night. Okay, let's bring back in our experts. And I do want to, we've managed to grab Jez Medinger, so we'll have a very quick chat to him as well. But let's just bring back Danny Altman. And we've also got joining us Elaine Maxwell as well, who's a scientific advisor of the National Institute for Health Research. Danny Altman, Professor of Immunology at Imperial College London. I've got a question here to aim at you both, actually, if you don't mind. Andrew's been in touch and said, interesting discussions, really a ticking time bomb with around 2 million people having long COVID so far. With all the restrictions being lifted, how many will end up with it by the end of the year? And I don't think he's looking for an exact figure, Professor Danny Altman, but what he's saying is, look, will the restrictions being lifted mean even more drain on resource, mean even more people suffer from long COVID, perhaps unnecessarily? What's your take on it?
My take is that I'm very worried. So I've got to try and answer this diplomatically. So I try not to make any kind of political pronouncements that go outside of my science remit. But I certainly sense that there's been a policy decision to have Freedom Day, and in order to make that decision, it's been necessary kind of to push the long COVID risk to one side. And
we're losing you slightly.
Oh, sorry. Any good now?
Try again. So this is. I'm sensing, and I'm going to say this for you, a political decision rather than a scientific decision. Easing restrictions.
Yes. So all I was saying is that to invoke the the march towards Freedom Day, it's been necessary to kind of push long COVID to one side and say, well, perhaps it's not really a risk, or perhaps it won't be a risk in a largely vaccinated population. And, the answer is it simply is, and it's there, and it is a ticking time bomb. And if we let rip on the 19th, it'll get larger.
Elaine, let's bring you in on this. Your opinion, please, on the restriction of the easing of restrictions on July 19th.
I'm very happy to say clearly that it will make long COVID cases go up. Secretary of State's already on record of saying that he thinks we could get to 100,000 new infections a day. If we take the lowest estimate for the number of people who get long COVID for more than 12 weeks, it's about 14%. That's both from American studies and the ONS. That's a lot of people. And in fact, Chris Whitty spoke at a conference a couple of days ago where he said there would sadly be a significant increase in long COVID.
He did recognise that, didn't he? Which I thought was pertinent, maybe done on purpose. So 100,000 infections a day, 14% of that, 14,000. So 14,000 cases of long COVID a day, potentially. The lowest estimate has been about 500, but if we take those upper estimate figures, 14,000, that's an incredible lot extra to add onto the long COVID care list, isn't it? Thank you to both of you. I'm going to let you go because I've got Jez Medinger on the line, who's been doing lots and lots of research, and I'm desperate to catch up with him. But thank you to both of you for your opinions here on the show. Can I just take a quick temperature check on both of you? Vaccinating children, should we make that a priority just in terms of our understanding of how children are being affected by long COVID? Danny Altman.
Yes, otherwise we'll be brewing long COVID and percolating variants in children forever. Definitely yes.
Okay, and Elaine Maxwell?
Well, I'm still not 100% convinced that vaccinations actually prevent individuals from getting long COVID. However, I think that vaccinations will reduce the pool of virus, so it's a good thing to do. But I wouldn't want people, I think people would still have to be careful, children included, after they're vaccinated, if they really want to reduce their risk of getting long COVID.
OK, thank you to both of you. Danny Altman, Professor of Immunology at Imperial College, and Elaine Maxwell, Scientific Advisor for the National Institute for Health Research and on the NHS Task Force for Long COVID. Thanks to both of you for joining us. Really appreciate your take and your opinions on this. Let's say a quick hello to Jez Medinger. We couldn't get hold of you earlier, sadly, Jez. We've not got a lot of time with you, but I am keen. I am keen to catch up with you. Tell me how you are. And obviously, you do a whole lot of research. You speak to lots of people about their long COVID symptoms, and I know you keep across a lot of the developments. So tell me what's new.
So what's new since the last time I spoke to you? The answer is, I guess I've been doing slightly better in the last few months. Although the reality is that, yes, I'm doing slightly better, but compared to, I guess, a normal sort of human being who walks past on the street, I'm still a bit of a mess. For the people who got ill in the first wave, so that's March, so we're now at sort of months 15, 16, we are seeing a number of them saying that they are starting to feel like they've turned a corner, but there's still quite a long way left to go. You know, it feels like we're out of sort of the pit of despair that maybe sort of ate us up for the majority of the first year. But you know, like we're saying, like 14,000 people getting long COVID every day. This isn't like, well, that's them wrecked for a year plus in all probability, you know, and we don't know how long the plus is on the end of that year either.
Yeah, we are. Yes. Yeah.
It's going to be different for everyone as well. So
of course it is. So
it's the unknown here that's so scary.
So time has helped you a little, Jez. Tell me about treatments. Has there been anything that you've come across or that people have been sharing with you that's been particularly helping them?
It seems very simple, actually, but this has come from one of the first places to pick up on this was in the States. There's a doctor over there called David Petrino. He's got a long COVID clinic at Cedars-Sinai in New York, and breath work is one of the things that he spotted could actually make a real difference, because what he noticed amongst his cohort of patients is that a lot of them had very irregular, shallow breathing. They simply just weren't breathing right. And this is essentially dysfunction of the autonomic nervous system, which means that your body sort of forgets how to breathe in a funny kind of way.
So you almost need to learn again.
Yeah, and so you have to almost start retraining your body in that sense and calming down the sympathetic nervous system, which is the fight or flight sort of side of a nervous system, and trying to engage the parasympathetic, which is the rest, digest, heal, which is what we would normally spend the majority of our day in that state. And so actually by sort of controlling the breath and doing it very deliberately and deeply, we can actually sort of trigger the vagus nerve, which encourages the parasympathetic side of the system. And that can really actually make a big difference to people's symptoms, because it affects so many of the systems as a consequence of that.
Yeah, OK. And Jez, tell me about long COVID clinics. Have you been to one? Are they being used? Are there terrific waiting lists? What's the development there?
So I'm maybe not an expert on this. I tried to get referred and failed. And
why did you fail to get referred?
Well, I got a phone call from a respiratory consultant after about 3 or 4 months after my GP referred me. And then he said, it was a 5-minute sort of consultation. He said he was going to refer me on. And then I just sort of, again, disappeared into the into the void a little bit. Yeah. And my understanding is that there are huge queues and people do spend a long time trying to get into the position where they can be seen by the long COVID clinics. But the long COVID clinics themselves are doing lots of investigations to see what's wrong with people, but not all of them necessarily have much in the way of treatment they can offer at this point in time. So
OK, so lots of research, but not necessarily lots of treatments.
Yes.
OK, all right. Well, it is a TBC situation again, isn't it, for you and for everyone suffering with long COVID as time marches on. Hopefully you will get better, but it's pretty slow, and there'll be other people, and I suppose this is the scary thought, Jez, who will contract COVID in the next month, 2 months, 3 months, 4 months, who will go and get long COVID and be in the same situation you were 15 months ago.
Absolutely. The hope would be that some of the lessons that we've learnt the hard way in the last year, they can sort of take heed of. And those include things like the importance of pacing, not rushing back to work. And those two things are absolutely critical. If you find that you have ongoing symptoms a month in, for example, absolutely critical that you stop exercising and you start trying to work out what your energy envelope is and what you can stay inside without triggering post-exertional malaise, and be very careful about going back to work and taking on what you maybe used to have too quickly, because that seems to be the major driver for people having relapses and making the illness last longer, essentially.
Give us your YouTube channel, Jez.
It's run-DMC.
There we go, run-DMC for Jez and his YouTube channel. He does speak to a lot of experts and just, has acquired such in-depth knowledge really through necessity and his own journey with long COVID. Jez, hopefully we'll catch up with you soon properly, but thanks for having a quick chat to us there, Jez Medinger.
Yes, pleasure. Thank you.
Okay, I'm going to bring time now on that long COVID section. We will cover it again. This is something that we've done 4 or 5 times here on the show, and we will keep dipping into it for you and keep asking all the questions, hopefully, that need to be asked.